really find that we're really going to put people in the center of all of our conversations. And we're going to start that with C for community, not cookie. So, and in addition to me, I'm just sort of anchoring this great team, the dream team as I've been calling them. I have 3 great colleagues of yours joining me today. You'll hear from them in a few minutes. Dina Ray from Mississippi, Kim Petrelli from the great state of Texas, and Michael Simoni from Arizona. So we'll be walking you through a new way of looking at C for community. Some of you might find this slide really familiar, right? The mission engagement framework. Some of you in the East have seen this. Julie Laird is smiling, I'm sure. This is really the start of putting mission in the center, as Darren mentioned, right? So it's a funnel that challenges us to think really deliberately about how we are going to engage a donor. And when I say a donor, just like Darren mentioned, I'm talking about a donor that could be an individual, a corporation, a fund the mission person, an events participant. All of those folks are donors, so a little d donor. What we're really going to focus on today with this session is personalizing it. How are we going to use community to personalize our story? So we're going to expand our sense of community. Remember, it's a new day, and we want to think bigger. We want to be more innovative. How do we leverage community to really show people and engage people with our cause? Our cause is important. We've helped every baby born in this country for the last 76 years, and we're doing something for those families who've had a baby who's been born too soon. We want to match our efforts to the community, to the constituent, to the person, putting them in the center of our conversation. It's not about us, it's about them. And then we're going to do some practicing. So C is for community. This looks really familiar, right? Everyone has an impact report. Scott Burns, Kelly Ernst, great job again with the Mission Impact Report. If you haven't read it, it's in your packets. It's amazing. And this is really the way that we usually start our conversations. I did this when I was in the chapter as well, right? So this is a grant summary. It talks about how much money we're giving away for each of these different areas. $5 million, 550 community grants. All of you all are doing this very important work. But things are changing, right? Maybe you didn't have quite as much money last year, 2 years ago as you have coming up. Things are getting different, so we need to think about how we want to talk about community and community grants. We want to start here, right? We've actually helped 1 million people, patients and professionals with our work, and you can see we're really leaning towards prematurity, which fits so nicely in with what we're going to be talking about today. So if you haven't seen the Community Impact Report, please look at it in your folder. And also there's a lot of information on Dimension, and Kelly is here, and I think Scott Burns is here too, and I know they would love to talk to you a little bit about that. But it's much more than community. How do you leverage, this is what we're doing in the community. March and Ives is giving folks this in our community, right? How do we flip that conversation? It can be so much more than just what it's a two-way conversation. It's not just what we're doing for them. So maybe it could be, community could be around a really important part of your life that changes your life. It's meaningful, right? Live Strong created community, and cancer may leave your body, but it never leaves your lives. They changed the conversation about cancer. It's not just about being diagnosed, it's about survivorship, right? So let's stretch how we look at community. Many of you guys are familiar with these guys, right? Their whole motto, right, hog owners, their community is wherever they ride, right? They built a brand, and wherever they ride, that's what their community is. And you know them, you see them all the time. You know that they're coming down the street. This is another one, a brand one that's really, really, I think, important. Dove took this many years ago, and they polled women across the globe. Only 2% of women felt that they were beautiful. They changed a conversation in a seemingly unrelated women across the globe, about what beautiful is. And further, they took that to mentor girls, young girls, to feel more beautiful and more self-confident. They built a community. It's a brand. They sell soap. This is one of my favorites. I live in D.C., so I have to have a little politics here, right? So Sarah Palin, remember when she was campaigning? She talked about hockey moms, soccer moms. Remember that? Just not a pig with lipstick or something, some sort of joke, right? And just to be fair, I got to be fair both sides of the aisle because I live in D.C., right? Hillary Clinton wrote a book, remember? 1996, It Takes a Village. how important it is for us to raise our children to be hopeful and healthy, but it's going to take everyone in the community to do that, right? This is not based on geography. It's not just people who lived in Arkansas, right? It's people around the country that we were all uniting to raise a community of healthy, happy, hopeful children. Could be somebody who's bridging the gap between the old and the new, right? The new pope, he certainly has a strong foothold and a following, right? But he really has a new message that brings together people, not even just people in the Catholic faith, people around the globe from other disciplines and other religions. Or the Dalai Lama, I love this one, right? More spiritual, but he really talks about having connections in your community, and that we're all social animals, right? So it's a community that's not built just on where he lives, right? It's a community, a global community. This one I had to include a tree hugger. Many of you might know I used to work for the National Wildlife Federation. And I included this, and I know this little girl actually, because tree huggers, it can be sort of funny, right? But it can't be black or white in that world. You're either in it to conserve or you're not. But it has no bounds, right? There's no one place that we're trying to conserve energy. It's a global phenomenon and movement. Maybe some of you guys are parrot heads or parakeets. I just learned that parakeets are children of parrot heads who follow Jimmy Buffett. In case you wanted to know, maybe you're a deadhead, or you don't want people to know you're a deadhead, or just to be a little bit more current, not show my age quite as much, maybe you're a Swiftie. Maybe you follow Taylor Swift. By the way, she wins, hands down, 60 million followers on Twitter. This is for Chris. It could be about pop culture. It could be Dr. Spock or Captain Kirk, right? A culture that follows this story through so many years. Oprah's book club, right? This could be about expanding your horizons, reading in a hobby that you didn't do before. For the book publishers, it could be loads of money. But originally, it was set about to bring community together around a story, right? Reading a book, drinking some wine with some friends, and also building a community across state borders around a book, around literature. The Motherhood is a community of mom bloggers that engage, they curate and engage moms to talk about certain issues, right, online. It could be college buddies. Thank you, Shelley. This is from the New York Sports Awards. The gentleman with the blue tie is my dad. It could be about a history and football program, Julie Laird. It could be about your alumni group, right? You have something in common. It could be about the military, current service member family members, or people who might serve in the future. It could be about youth who are so excited to support a cause that's meaningful for them. And it could be a community that knows no boundaries of what they will do to protect their child and to make sure that those long days and nights result in that baby coming home. So a community, really simply, is just a group of people that have the same interests. Let's not overthink it. Like for a change, like let's free ourselves. This is a great word cloud, right? All these things that we do, we help, we change, it's about people, it's about knowing what their common interest is, right? So we're community people who cherish babies, health information, a legacy of innovation. Remember that? Sharon was talking about how we were innovators? That could be us again, and it will be on Thursday. And we also know how to do scalable problem solving. This is not bound by geography. This is not only what happens in Chicago. It's much more than that, or what happens in Rhode Island. And the world is flatter, right? I mean, communities are everywhere. There's social media communities. People can talk to each other 24/7. This never, ever stops, right? So the world is so much flatter, so we can build communities anywhere. So how do we change this conversation that we usually start out talking about what we do for you in our community? This is what the March Times is doing for your community. Great place to start. But how do you create a conversation that's more of a two-way street? How do we connect the dots to our important work that broadens your conversation and makes our work super relevant. Many of you, I'm sure, will be happy to see, and Staryn talked about this as well, we're not going to be so transactional. It's going to be about the March of Dimes first, and then all the activities that we do, right? Not just a program or an event. And again, I can't say this enough. It's all about them, not just about us. So you all know all the communities that we have. This is only like a true sampling of some of the communities of folks that we work with, right? You guys all know this. You're in these communities. But for me, looking at this from sort of a corporate marketing standpoint, or gosh, only a fundraiser, just a fundraiser standpoint, this is gold. This is gold. Look at all these groups that we are working with. How do we tell that story? So I have a great answer to that question. We're going to flip the model. We're going to talk about how we learn from putting people in the center of the community and what's important to them. And we're going to start thinking about how to do that with 3 examples from my presenters, yay, today. And also just wanted to say you can learn this through exploratory meetings. There's been a lot of buzz about that too, so I just wanted to put that plug in there. It's listening and putting people at the center of the conversation. And then I love this little comic, right? I'm a doctor, a lawyer, and your congressman. Are you a patient, client, or constituent? That's what we need to figure out when we're talking to people. What's of interest to them? What's important to their community? That's the part that I feel like will really tip the scales. We're at a tipping point and help us unlock opportunities to other mission and revenue for the organization. So with that, the how question is going to be answered by Dina Ray, Kim Petrelli, and Michael Sponey.
Good morning, and welcome from Mississippi. Mississippi is a little different. For those of you that haven't been there, I invite any of you to come see for yourself. But we have always had to think outside the box because the box didn't really work in Mississippi. And so when I arrived there, one of the things I was struck by was that no one knew what March of Dimes did in Mississippi, and we could not rely on the whole, what is there a grant in my community, because our grant line was so small that even if there was a grant in the community, it wasn't large. So we had to completely get away from that mindset of what are you doing here locally. So in having said that, I started thinking, what groups have lots of people? Where do we go for grassroots efforts here? And I loved the story about the dime cards and the kids sending dimes to Washington, D.C. And I said, well, in Mississippi, we do have schools. There are schools everywhere. And I have 3 kids that go to a school, and they actually go to the school system that we started with. So I went where I knew people. And we said, let's start the conversation by asking for a leader. We were very fortunate at the time that there was a brand new superintendent. He was looking for a great opportunity to get his name out there. So with the help of some volunteers who also had children in the same school district, we all went together and asked him to be an honorary chair for March for Babies. I don't know that it's so important to give somebody that specific title, but what's important is that they feel they have a leadership role. That when you ask someone to be a leader, magically they step up and start to lead. So what we asked of him was that he would get his entire school district involved for that year. They really only were committing themselves to that year at first to get all their students engaged. So that's kind of how we did what we did. The results, very successful financially and have grown significantly. But I want to, I went back. I want to just talk a little bit about how we connected that message to them. Because in schools, you have students, parents very engaged. You are in your community. You're a big part of your community. And, of course, your faculty, which is largely women. So it was also a group of folks who were very much affected by our message. But one of the overarching things to me that has been amazing about children is that they get the message in a very simplistic way. Healthy babies. I get that. Little kids get that. And so I think sometimes we make it so much more complicated because we're trying to sell it on and we do this, and we do this, and we do this, instead of saying, we've been affecting change for 77 going on years, and you've been affected by it. Everyone here's been affected by it. Children can significantly affect the future by learning that this is something they need to have on their radar now. So we really related to the cost for prematurity in our world of Mississippi, which was driven largely by having the highest rate of prematurity in the nation. So it's an easy sell to say, look, our schools are affected by this. These kids all end up being your students. Your education costs are affected by this. If our state didn't have 68% of our births born on Medicaid, you'd have more money to put back into your schools. So the message was very easy to relate, and we've been going strong now for 4 years. We've reached out to other school districts across the state, and our superintendent that started out working with us has been on our state board for quite a number of years now, and he has reached out to other superintendents across the state to ask for their support too. So thank you for listening to our spiel on Mississippi schools. And with that, I would like to introduce Kim Petrelli, Executive Director of the Austin Division in Texas.
Good morning, everyone. It's so great to see you guys. I'm so happy to be back at Summer Staff. I haven't been here for 3 years, and last time we were here, I had a great time, so excited to see you. I am really excited about sharing this next opportunity to engage in a community, and our community is corporate partners and their employee base. So as some of you may know, Austin has a really strong partnership with Dell. But that's not something that happened overnight. That's something that we had to cultivate years and years. We've had our partnership with Dell for over 15 years. And it's ebbed and it's flowed, and there's been challenges and successes, but it's something that we've really put a lot of hard work into. And a couple of years ago, we almost lost them. They were doing a lot of internal changes. We had our way of doing things, and we weren't really listening well to our corporate partners and what they wanted. So what we did is we listened, and what we heard is that the company really wanted their employees to engage in a cause, to feel like they were connected to a mission. Well, that's a little harder as a national organization, as we know. We're not a food pantry that people can walk into and feel connected to and walk out feeling really good about themselves. It's harder. So one of the things we did is the staff got together, our fundraising staff and our program staff, and we brainstormed. And I'd really like to shout out to Katerina Kormas, who is my March for Babies director, because this has been really her baby. So we brainstormed, and what we decided to do was we decided to come up with this informal volunteer program to offer the Dell employees opportunities to engage hands-on with our mission. So in the past couple of years, we've had probably over thousands of employees knit babies' hats for the neonatal intensive care unit, write thank you notes to our donors, to do Valentines for the families and the nurses in the units, do something where they feel good about what they're doing. We feel good about what they're doing. It's helping us out, because we all know we're short-staffed and low-resourced. And then they leave feeling really good about the March of Dimes and the March of Dimes cause. They feel connected to us, engaged with us, part of our March of Dimes family. And that has really led to these huge gains within the past couple of years. So in 2 years, what we've been able to do is we've been able to save this partnership, engage this employee base, thousands of employees who've done all this work for us that we really needed to do, and we've got to do a couple of other really cool things. So we had our first Dell World, where we were the only charitable organization represented at this huge corporate event called Dell World. And you'll see in the picture, those are our company captains, who are amazing, and Jeff Clark, who I'll talk about in a minute. And then we had this international Go Purple for Preemies event this past year, where Dell activated all across the world Go Purple for Preemies during Prematurity Awareness Month. And they were able to get people to wear purple, send in their pictures. We did a big social media push, and you'll see that India was represented in their beautiful, stunning, gorgeous saris. It was really exciting for us. So finally, March of Dimes was being integrated into the corporate culture of Dell, and that has really served us so well. And really exciting, we had a 2015 March for Babies chair, Jeff Clark, who's the vice chairman of Dell, serve for us, and that has led to all of these interconnections, these linkages that we would never have had we not first worked on engaging the employee base in the way they wanted to be engaged in our cause. So exciting. We're really proud of our partnership. There's still a lot we can do with it. But what's exciting is this new method of going into companies and asking them, how do you want to engage with March of Dimes? How would you like to engage with our organization? What are you looking for in a charitable partner? Can we fill that need? It may take some creativity, it may take some innovation, but it can really work for us if we just listen. So one of the things I want to do is I want to cue the video. We have just a video from Jeff Clark who kind of shares his perspective on our partnership.
Hi, this is Jeff Clark from Dell, and I have the privilege to serve as chair for the March of Dimes March for Babies this year. I'm excited about this mission because it's very personal to me. Both of my children were born prematurely, my son 4 weeks early, my daughter 6 weeks early, who spent time in the NICU. So this fight against premature births that the March of Dimes has led our country in for the last 75 years is hugely important to me. I encourage all of Austin to embrace this, to have the impact, the technical community, the community at large in Austin, to really change and have an impact of what's happening with premature births around Central Texas. Central Texas actually has a higher premature birth rate than other parts of the country, and it's up to us to really have an impact here to fundamentally change that. So I encourage all of us to get involved and to have an impact.
Over to Michael, I just want to say just a last thought about our partnership is that we had to learn something. We had to listen and learn what our company wanted, and by doing so, we've been able to just expand it more than we ever could. So, you know, as we're moving forward with all of these changes, I just really encourage you all to just figure out how you can fit into what they want, what makes them excited, how they want to engage, and bring them into the March of Dimes family, because by doing so, you're just going to be amazed at all of the new opportunities that present themselves within your market. So thank you.
Good morning, everyone, and thank you, Kim. In Arizona, the preterm birth rate among Hispanics is much higher than the state rate. So for us, we really wanted to target this group naturally because as our mission states, we really want to make an impact on this group. And what did we decide to do was not what I felt we were missing was just having information in Spanish or a Spanish language website doesn't mean you're reaching out to the Hispanic community. So, and I thought for a long time we were looking at it that way and saying we had that covered. So I did what I thought was the best thing to do, and which always turns out to be the best thing, and that's reach out to our volunteers. So I reached out to our volunteer, and at the time was our state board chair, and I said, we really want to reach out to the Hispanic community. What can we do? And she said, I have a great idea. I think I can introduce you to the National Association of Hispanic Nurses, and we can see if we can form some kind of partnership. Now, as Staryn mentioned earlier, when you lead with mission, good things always come, and that's what I try to remind myself is going into these meetings and these appointments is to try to lead with mission first, and things seem to take care of themselves from that point forward. So for us, when we met with the National Association of Hispanic Nurses, this was like the first thing I stated, because everyone can relate to this. I don't want to create any new events. I don't want to create any new projects. I want to see what you guys are already doing and what we are already doing and how we can work together to make that work for this community. And the important thing for us, from March of Dimes' perspective in Arizona, was that they are the experts in this community. They know what resonates. They know how we should frame our messaging. They have the credibility when they reach out to their constituents as far as the importance of lowering the preterm birth rate among Hispanics. So what we did was we decided that we were going to incorporate a member of their association with some of our existing committees, and we started with the Program Services Committee. That made the most sense because when we are trying to implement our community grants and our programs, we need an expert in the Hispanic community to guide us and direct us what is important, what kind of questions do we need to be asking in order to make a difference. And my long-term goal is, by having their relationship with us, we will then open up doors to volunteer leaders in the Hispanic community who see that we're speaking to that community the way we should be, in the way that will impact their business. Also, the Nurse of the Year community. That sounds like a natural fit, and it has been for us. We wanted to then take their opportunities that they're already doing, their local conference, their tabling events, and have our information and materials present and educate them. We didn't just hand them a box of stuff, we educated them on how to speak on our behalf. So we don't send staff to all of their events. They go to their events and they speak as advocates for March of Dimes. And then naturally, a March for Babies team made a lot of sense. Builds their community, brings them together. You know, the National Association of Hispanic Nurses, they work in different hospitals, health centers throughout Arizona. So that opened doors for us into these hospitals and businesses. Rather than go to each one individually, we went to the association, who already had a footprint throughout these organizations. And as we all know, when it comes from within, whether it be an employee or a volunteer, those requests tend to move to the top of the pile and get heard more than when we go in ourselves. The results have been fantastic for us in just a short time in our partnership with them. Not only did they form a March for Babies team, not only have they helped nominate nurses, and I think this has been a wonderful door opener for us, because these nurses are being nominated by their peers in the Hispanic community, and they would go to their supervisors within, and the CNOs within these hospitals, and the request would come from a colleague of theirs, and it would open up opportunities for us to then go to these hospitals with Nurse of the Year sponsorship opportunities, because they saw that it was an important, it was something that was important to their Hispanic community within their hospital. And what's been great is the ripple effect from this first introduction to the Hispanic Nurses Association. We have now met with the Filipino Nurses Association and have a meeting scheduled with the Black Nurses Association with the same goal in mind, is to partner together with things that we are already doing. And what's great for us is we have been able to take these partnerships and translate them into media opportunities as well. You'll see here, March for Babies Phoenix, we had Rachel, who spoke on the importance of safe sleep issues in a live TV interview. It was great for her as an individual. Something that was appealing to the association was personal and professional growth for their members, and March of Dimes offered that. It was also great for us to have a presenter from the Hispanic community talking about the importance of safe sleep, which is a major issue in Arizona. And it's coming from someone within their community, and Rachel has a personal story. She also lost a child to unsafe sleep practices. You'll see here also March for Babies team and the tabling events that I spoke about. And since this relationship began, the association also had some radio interviews which came up, and they reached out to us to see if we wanted to be a part of it. And really what we ended up doing was training the speaker from the association to speak on our behalf rather than have one of us go there, and that's been very powerful as well. So I really am excited about the possibilities that this relationship has to offer, and I know that they're excited about it as well. And when we reach out and look to communities in our respective states, we have to try and think of what can they already be doing for us in addition to what we are doing for them. So when you think of it that way, it's kind of easy, and it takes care of itself, and things just flow, and you find out that it's a really easy relationship to formulate. In your handouts, you should have local National Hispanic Nurses chapters in your states. And I would encourage you to reach out and just start a conversation. Our first meeting was nothing more than a conversation, and things led from there. And if you need any assistance as far as reaching out to your local chapter, Adriana, who's the president of the Phoenix chapter, would be more than happy to help make that introduction. So thank you all this morning, and I know Mary Margaret has some fun activities to get us thinking differently as far as our own community. So thank you.
Thank you. Great job. Thank you, Michael. I told you they were the dream team. What I love about these stories, it's sort of intentional, of course, right? It's so natural. You build a bridge naturally between mission and revenue. Not difficult. right? Does it sound like anything they did was difficult? Sounds sort of magical, like it would be super easy. We're putting the community in the center of the conversation, whether it's the schools and really being intentional, right? Mississippi doesn't have, I love corporations, but Mississippi doesn't have a lot of corporations, but they have a lot of schools. And in your handouts as well, in your binders, you'll see Dina has that whole list of how she talks them through why our cause is important to them. It makes it an easier conversation to have, and things follow from there. And the second example, Kim, of course I picked a corporation, but I'll be really honest with you, I just picked Dell because it was a corporation. It was the way that they built their employee engagement. It's the way that they were patient about building and cultivating the relationship that brought them the leadership for March for Babies. That was the cherry on top. I think that's what Kim told me when we were talking. So, and I love the way that they really celebrated the mission with this company, not just in Texas, but remember, it's not just about geography, but globally with women in India as well. So I think there's a great story, a compelling story for all of us there. And the third example, Michael's example, I think is also a great starting point of how we think of, we were actually whispering to each other backstage. We think of professional groups, and we sort of think, well, they just do that, right? They're a professional nurses group, or they're a professional this kind of group. And we don't think about how multi-dimensional they are. And all the things come from that one conversation. And just to highlight what Michael said, it was just a discussion, just a conversation, not a bunch of stuff, not a lot about us. Let's have a cup of coffee and let's learn about what you're doing and how we could work together. So I think there's some really good stories behind the stories here. Really think about your mission, your stats for your mission, the community impact report as the starting point of your conversation. We already are working with these folks. How do we bring it to life for them? How do you make it a two-way street in a conversation? How do you build your bench of people that can help you in the community? How do we make it about them giving back to us, for all of us to work together in this larger community, find find an end to premature birth? And certainly engage your networks of volunteers and colleagues. Michael really talked about this, but every one of these examples is based on a volunteer relationship, cultivating those relationships. One of the cautions I wanted to bring up, and we were actually talking about this, Michael and I were talking about this morning, is avoid making assumptions. We make assumptions all the time. We're just human. It's human nature about communities, about donors, what they might be able to do for us, what they aren't going to do for us, right? We make these assumptions about people, and we need to let that go. Have a conversation and find out what their intentions are. Don't make stuff up say something else. Don't make stuff up about that community and that person, that donor, because you don't know until you ask them and have a conversation with them. Please do your homework. We talked about this in the March for Babies session yesterday. Don't wing it. And start small and build some confidence. I like to say, don't eat the elephant in one bite, or don't boil the ocean. Just start small. And you will see that if you put people in the center of these conversations, the community will support you just like we've been supporting the community. And please, while we're talking about our teams, right, don't forget your bench strength. This is a lot of stuff here that we have already. And better than that, it's in multiple places. Talk to your program services folks. Talk to your volunteers. Talk to the national team who's amazing at delivering programs on the ground. Don't forget about those folks. Don't forget about the mission impact report that's in your packages, the prematurity campaign report's also in your packages. We have a lot of materials, and reach out to us. On the national team, reach out to Michael, Kim, and Dina if you want to further talk about some of the things they're doing. We have resources. We just need to help you put them together, and we're more than willing to do that. The final thing I'll say about resources is I had a great conversation at Ed's table about real employee engagement and how great the employee engagement ideas were for Dell that Kim shared. So that is something we know is really important and we're working on. How do we create turnkey opportunities for you all to learn what Dell's doing and what you might be able to take to other companies or other groups? It doesn't have to just be about companies. So employee engagement is super important and making it meaningful engagement. Think about community. I hope that using some of the innovation engineering techniques you'll learn more about on Thursday with the Spark Deck, and really stretching the way we think about this word community, that you'll think about how to cultivate your relationships. Remember the time that all three speakers talked about. They don't just parachute in and they get a chair. They don't just parachute in and they get a big gift. You have to cultivate, you have to listen and talk to folks. Jeff from Dell talked about the impact. Find out where the impact is for them. What are the drivers for them, and how can we deliver impact that's meaningful to them? Think about community as constituents or groups of people. Remember the bubble slide of the moms and the military families and the scientists, all the groups of communities that we work with. And think about how you can leverage those groups to further your work, both for program and mission and fundraising. And last of all, network, network, network. Right? We have these communities right in our areas. We have to start thinking about them more broadly. They're not one-dimensional, and they can bring a lot of support for the organization. So think about that as you return home. I hope this has been meaningful. Thank you very much to the 3 presenters, and we'll break, come back at 9:30.